So, guys, we are back and we're live on the Liberian Radio and Television Network. We're bringing you live coverage from Rising Sun Avenue in the Northeast Philadelphia. I'm privileged to have two doctors. I'm a rich guy with two doctors. So I don't think anything is going to happen to me. I'm in the right place.
At the right time.
Yeah, at the right time. So I have Dr. Andrews and I have Dr. Hung Pham. Okay, Hung Pham with me.
Dr. Andrew Ankama.
Yeah, he's Dr. Andrews is from Ghana and Hung is from
Einstein.
Yeah. Wonderful. I have two great men in my presence. So I'm going to have, I think Dr. Andrew was on earlier and he introduced himself. So I'm going to have Mr. Hung introduce yourself, who you are, a little bit.
Yeah, sure. So my name is Hung Pham. I graduated from Pecan Philadelphia College of Osteopathic Medicine. I went my training with PCOM too as well, and now I'm practicing at Einstein Medical Center, outpatient at Front and Olney.
Oh, okay.
I've been here for about 30, I would say about 30 years in the United States now. Been in Philadelphia in general about 20 years, and I'm very fluent in Vietnamese. I speak Vietnamese, and I also speak English too as well. And I think our practice is composed of like a lot of the very diverse group of number of ethnicities and nationalities too as well. Vietnamese, Latina, Spanish-speaking, Haitian Creole, Vietnamese, Cambodian, and also Laotian too as well.
Okay. Now you live in an area where it's very diverse. I know this area. And this hospital is, clinic is in an area that is very diverse. So I know the health issues in Philadelphia is a very big thing. Okay. So what's your take for the health fair? How did you get involved?
Well, one of my patients is one of the administrator here. She invited me, and I said I'd love to come, even though it was kind of late. I was so busy. I just had a baby, and
wow, okay.
So it's just a lot of commitment. I think I have a lot of my take my ultimate goal in life is about giving back to communities. I grew up here. I like to give back to my communities as well.
Okay, all right. And we have Rabbi Andrew, who is a doctor in the faith and in the physical. Yeah, so Dr. Andrew. Okay, now let's get into this. We found out that there are a lot of disease, a lot of things that are happening, and it's good for you to have you guys here. What is one thing that you want to talk to the audience about when it comes to in relationship with health?
Yeah. So I guess like the main thing is I think everybody talk about in the healthcare is the health disparity. So most particularly women's health. There's a lot of health screening that needs to be addressed. Mammogram, pap smears, and also for just in general for all people, colonoscopy. They recently changed the colonoscopy from age 50 to now age 45. That's something that we need to address. Colon cancer is growing up so fast right now. The diagnosis of it, we need to address that soon. It's growing right now. It's at number 2 in the world, in the country right now. It's going to be number 1 soon.
Wow.
Yeah. So it's a thing that a lot of people need to talk about. I think a lot of people don't talk about.
Okay, and Dr.
Yeah, my specialty, first and foremost, I'll introduce myself. I'm a Temple University grad.
Okay.
And my specialty is sports and spine medicine.
Oh, wow.
Also physical medicine and rehabilitation.
Oh, wow.
Meaning all the orthopedic areas we cover. Our goal is to prevent an operation until as a last result. But to continue from what Dr. Pham just said, I think our culture, most African culture is we don't want to go to the doctor until it's very, very severe.
Yeah.
So I'm a very huge advocate of prevention. It's always better than cure. Make sure that you go for your yearly checkups, both the men and the women as well, if you want to live a happier and longer, healthy life.
Okay, now let me ask both of you. Do you guys have a problem with, do you face a lot of problem with language barrier?
Oh, yes.
Especially,
yes. In my practice, I remember the number of languages I speak, languages we experience with. When the language barrier comes in, is the fact that they try and follow up with appointments, like colonoscopy. You tell them if you tell them to do a colonoscopy, of course they'll do it. But they have to call, make an appointment. That's the barrier. Yeah. Call the next step. It's just a follow up. That's the thing that's hard. we're trying to do is trying to promote is in our practice in Einstein is that there's always a translator on the phone and trying to translate them and try to schedule for them too as well. But it's hard, you know. It's still primitive right now, but we're trying to grow more and more, and then get people screened early and quick, you know, in and out, and try and get everything done so that they can live, like Dr. Andrew said, live a happy, you know, healthy life.
And Doc, the same thing with you, dealing with people from different countries, and, you know, having different. Some people don't speak English and all of that.
Yes.
What's the challenges and stuff like that?
It can create a barrier. We have Spanish population, but likely we have some staff who speak Spanish, and therefore are able to translate. But it's key. Any time you don't have the translator, it impedes, you know, the healthcare that you are trying to deliver to them.
Okay.
And I think it's like important too as well because we have health fair, health clinic everywhere. So the kids pass by of different nationality, come by and see it. Like someday I'll be a doctor and I can contribute to my own people. You know,
Absolutely.
Like that's how I feel like when I grew up. When I didn't know what I want to do. I see a health fair. Oh wow, maybe someday I can contribute to society. So you know, it impact me. And hopefully someday the health fair and all this stuff we do is going to be exponential. It's going to contribute back to society. When kids grow up, they see what they see, and they grow up and make up. You know, maybe someday, this health fair, maybe kids come by and see us, and maybe 3 or 4 of them become who are not speaking English right now, and then they're going to start speaking English. And they speak their own language, and they get back to the community, just like what we are doing right now.
Okay, so I'm not a health guy. Most of the time, I'll just go to
look good though.
Yeah, I go to the hospital, but when I go to the hospital, I'm scared that I always feel that something's going to happen. So what would be your advice to those that's watching? Most people feel that when they go to the hospital, the doctor usually just put something on them because they want the cash. People have the tendency of, so then you have good insurance, and you go to the hospital, something going to come, they're going to give you something, they're going to diagnose something for you. What would you say to that? Dr. Andrews?
I'll say that in this country, things are well regulated, and cameras are everywhere. So if you do something that is not ethical, it's going to catch up to you. I don't think any physician or medical or healthcare professional will intentionally expose you to any disease or sickness. So I think it's a myth, and we should lay away those fears and make sure we go for a proper treatment when the time is due.
Okay.
Well, I think like in order to gain respect, gain trust, like if you come and see me, you're scared. And then I think the way to handle it is everybody in the medical field give their treat your patient as your family. If I see you coming in, I see you're stressed, I can see you're scared. I will try to put my feeling to it. It'll be okay, you know. Put my feeling to it. Everything is going to be okay. But the thing is, we're going to try to do this step, like gain your trust, and that's how you can feel the trust and confidence in me. I think if you were scared, I'll try my best to fulfill your needs. That's the main thing, you know. And then that's when you feel like, oh yeah, definitely I need to do this. I think that's when you have trust in me. It kind of compels you to be more compliant with your medication and your follow up too as well.
Okay. All right. So this is good to have the health fair. I know a lot of people didn't turn up because of the holiday and all of that, and we're hoping that another one will show up where we all can have the opportunity to come and do that.
Absolutely.
What is one thing I would, both for you guys, what is one thing, I know you just talked about a disease that you talked about, you said it's going to be one, it's going to be number one very soon. Is there any other thing that you guys see often, very frequently, that have to do with both women and men? Any disease that you want to talk about?
It's not in my specialty, but I think cardiovascular.
Okay, what's that?
Right, that's heart attacks, heart disease, which can lead to stroke. And so many other complications. But I'll leave that to Dr. Fan.
I'll follow up with Dr. Andrews on the cardiovascular condition too as well. So the main thing is, let's say for example, how to prevent that, how to prevent heart attack and stroke. That's the thing that we all talk, everybody talk. The 3 things we talk that I teach my residents, I teach my even my patient too as well, is diabetes, high blood pressure, and cholesterol. If you control that, you control the heart attack, you control the stroke. That's the main thing. This is something so easy, as in like diabetes. Oh, it's too hard. You know, some of my patients would say, I can't do it. You know, I can't do this and do that. I can't take the medicine. But what about diet? You know, cut back on the sugar, cut back on the soda. If they were educated about diet-wise, it helps so much. Like Dr. Andrew was saying, that if you get treat the underlying problem, which is the diabetes, high blood pressure, that prevents the main problem, which is the stroke and heart attack.
this is a very good conversation. One thing I want to ask you about is, you find out that some folks don't have insurance, and they're home, and they feel that I'm not going to go to the hospital because I don't have insurance. If I go, they're going to ask me, they're going to give me all the bills. I won't have the money to pay. So what would you say to them? And is it possible to don't have insurance and just show up to, get yourself treated? I'll start with you.
Okay. Thank you for asking, Joseph.
Yeah.
This is a very common question that comes up.
Yeah.
In fact, Dr. Pham, when I was in medical school, we had a group discussion, and this question came up.
Yeah.
They said the patient doesn't have insurance. How will you treat them? Without me thinking, I said I'll see them for free.
Yeah.
I almost got into trouble after class. All my classmates were coming after me. Andrew, you see them for free? I said, of course. Life cannot be bought with money.
Yeah.
So if they don't have insurance, they should not refuse the care. They should still go.
Okay.
Especially in this country, they will be taken care of.
Yeah.
And the bills can be taken care of later on.
Yeah.
Life is so precious.
Yeah. Yeah.
Absolutely.
Okay.
It's an issue that we face every day. Some people, a lot of people, don't have insurance. They come see me with no insurance. What I do is, they're willing to pay that initial fee to see me. Unfortunately, it's through their network and everything like that. You really can't stop that. But they see me. But if they see me, I will put in 100% of my work. Basically, let's say they don't have insurance to buy the medicine that they need. Very common I see. They lose their insurance. They lost their insurance. They have to renew their insurance, so they have no insurance. And what I do is we use coupons. We use different pharmacies to try to connect with them, because some of the pharmacy have great deals, like $5 for 90 days medications. So like the main thing we were talking about, diabetes, high blood pressure, cholesterol.
Yeah.
There's medicines out there that are very inexpensive. They apply coupon, maybe even free too as well.
Yeah.
We have so much resources, but they don't know that, and this is my my responsibility.
Yeah.
Hey, I have this resource, this coupon here. I'm gonna give you a prescription. You go to this pharmacy and get that medicine for $5. I know it's a little expensive, but work with me. Try to get this medicine. That's what I do. I try my best. I put in 100%. I know they don't have insurance, but I'm gonna help them. Try to help them insure, because we have people that reach out to them and try to help apply for insurance.
Yeah.
And I completely understand it's hard. Sometimes they can't get insurance, but I will try my best and get their medicine and get what they need.
Absolutely.
Yeah, and we have a lot of folks that came from different countries, and they end up in the States, living in America. And some of the countries, people don't usually go to the doctor to take medication. They just sit home. And my mom used to, when I'm sick, she used to just fix something, some herbs and stuff, and give it to you. And I don't know whether it's the right thing she's doing, but you get better. Okay, so people coming to the States and living here, and when they find out that the kid is sick or something, they usually just go across the street, get something, and give it. What would you say to them, to those who just get something? Is that the right thing to do? From both of you, Dr. Andrews.
So, can you clarify the question one more time?
Yeah, people would give you without contacting the doctor. They have certain sickness. They would just come and just give you medication, and sometimes you try, and the person end up getting sick more because they don't understand what it's doing.
You're trying to do it.
Yeah.
Okay, my advice is that don't do that. That's why doctors are there. Seek the help of the doctor to prevent anything worse from happening.
Yeah.
You are not trained as a medical doctor. Don't act as a medical doctor. Contact us, and we'll always help you. If you don't have money, there's ways we can work around to help you get better.
Okay.
Take care of your life.
I know that a lot of my patients, they bring in herbal medicine, they bring in a whole bunch of stuff. I love it because I can actually see it and read it, and I go over them. That's why I do with my patients. Hey, can I take this medicine, or can I do this? I'll talk to them. Hey, my medicine has this and this. It can cause this. I'll tell them too as well. I know certain things that that's when I don't know. I'll look it up and I'll call them afterward and I say, hey, this medicine has potentially this cause this problem, other problem too as well. So stop taking it. Or if this medicine has no effect but it has some contributing factor to it too, antioxidants, anti-inflammatory, it might help. Then I'll definitely encourage it. There's always leverage and always different medication out there in the world, but some might help and some might not.
Okay, so those of you that are watching, we want to say thank you for watching. Keep watching. I got other guys that are coming up, but unfortunately, I have the two doctors, And you know, guys coming in, I can't keep them for a long time. They have to leave. So thank you for watching. We'll be right back.
Hey there. Many Liberians are members of social clubs, 501c NGOs, and school alumni. Many Liberians are trying to open their own 501c NGOs, home care agencies, and social clubs. Does your organization have a professional website? Does your web platform have the right wording and content to attract grants? Hopefully you're not running your organization only through social media. There's a more professional route. You need an online space where you can craft a positive message about your organization, making your home health agency more credible, which will increase your chances to receive grants. We'll build you a responsive platform for 501c organizations, healthcare agencies, and other types of organizations. We'll provide you with full website maintenance, membership sign-in, private charts, Facebook and WhatsApp integration, live video feed for all your meetings and special occasions, a dashboard for members to see all the activities, and email and text auto reminders for meetings. We'll build with donors and 501cs in mind, and will help you solicit grants and automatic membership due collections. Building you this amazing platform will only be a membership fee of $19 a month. Call or email us now. Let's upgrade your website. Home health agencies and small businesses, you owe it to your company to project the best image possible, and we can make it happen. Visit www.tiamit.com or call 215-966-8679. Ask for Tommy.
So guys, we're back, and this is the Liberian Radio and Television Network. We have the chief organizer of this affair. Miss Miranda is here with us. We worked with her before. This is not her first time being on the network. And we have a lady that's in the building that can actually make you go home and feel good. And from here, I'm going to go get my massage, and I don't care what you feel. If you don't show up, well, it's up to you. Well, I'm going to get a free massage. So, happy to have both of you guys here tonight.
Thank you.
It's nice to have you guys this evening. I mean, those of you that are outside and watching somewhere else, I don't know the time frame on your side, but this is it. So, Miranda, this is very wonderful. I mean, I came and I see a whole lot of things going on. Mm-hmm. And so, tell me a little bit of the fair. What's going on today? How did you pull this out?
Yeah, we wanted to address women's wellness needs. We have partnered with this clinic here, Newlands Health.
Yep.
And so we have an ongoing collaboration year-round that we provide all types of services, whether it's HIV testing kits at home, COVID-19. We used to do our COVID-19 vaccination clinic here. We would do our diapers and different things. We store different resources that we have, social services as well as health. We started the health care for women specifically to address the needs that are ongoing concerning immigrant communities that sometimes not getting the services that they need from the health clinic. And so the health clinic sometimes, there's so many barriers to access to healthcare resources, whether it's the time frame in which this is happening, like people have to work during the week, and sometimes your appointments, I noticed that people like me, myself, was getting appointments 3, 4, 5, 6 months. And if you miss that appointment, you have to start all over again. We're now getting back to a more normal stage of appointment making, but I thought it important to address the immigrant community and specifically for the women, because we're going to deal with the men after.
Oh, good.
Yeah, and that's some of the questions folks were asking, say, why women and not men?
Well, the men is coming up in July.
Yeah, but I mean, right now, anybody can come, right?
Yeah, anyone can come, yes.
It doesn't mean that you shouldn't come.
Men can't do pap smear. See? It's one thing they can't do is pap smear. So.
Okay, so now let's come to this beautiful lady on my right.
Hi.
So how did you get involved with this?
Well, my name is Marie London. I am the owner, CEO, and founder of Works of London LLC, a modern luxury skincare brand. I was told about this event by Miss Miranda. Okay. I was supposed to do a different event that she's putting together, but she said, I think you would work well with this particular event. So I just said, sign me up. I brought my not homemade, but my handmade skincare. Okay. I brought my massage chair to help, the community learn about the the benefits of massages and letting them know that, you know, it's okay to not only just get a massage, but it's best to stretch and to take your health seriously, because we only get one life.
That's good. Yeah. And unfortunately, I'm going to be getting one. So.
Yes, and you can tell the people how it was.
Yes, tell me about the skincare. What's that? Something you
Yes, so my signature blend has been in the works since 2013. The formula took me 7 years to create. My husband, who's a healthcare professional, he washes his hands a lot. I was already making skincare for myself, you know, for my own personal use, and he's like, hey, can you make the shea butter be creamier? Can you make it non-greasy? Can you make it more hydrating? I'm not a chemist, but that's why it took me 7 long years to create. But in that time, I was able to play with the formula 1,000 times, and with the butters that I chose to be in the signature blend, like shea, cocoa, avocado. I'm Haitian, so I have l'huile masquisi, aka Haitian castor oil in there, olive oil, avocado oil, all ingredients to help nurture, nourish your skin, and also keep it young looking, to keep it fresh. But the difference between my product and everybody else's is it's a non-greasy formula. So after you apply it, you're not going to feel slippery, slick. You're not going to be sliding all over the place. Okay. It literally goes on your skin. It penetrates into your skin, and it stays there, and it absorbs. And you're just giving glazed donut realness after you apply it on.
Nice. Yeah. So how can anybody get where are you located in the first place?
I am located in Philadelphia. I'm local. I ship, I deliver, I offer delivery, I offer pickup. You can find me at worksoflondon.com, or you can find me at Works of London LLC on Instagram and Facebook. To order the product, you can order it through the website, which is worksoflondon.com. And I'm local to the area, so if you need anything, I can always meet you for pickup or delivery.
And Marina, how do you navigate and get all these professionals? How you do it? How you really do it?
I don't know. I just work my
I was just sitting with two doctors. I was sitting with two doctors.
Like Caribbean Community in Philadelphia is my organization.
Yeah.
Yes.
I forgot. I heard you say all that, and I'm like, I forgot to say.
Yeah.
So yes, I really appreciate what happened is that we are village people.
Yeah.
When you see another villager like her, you say, okay, I identify.
Yeah.
I talk to you on the phone. I text you. We see each other, and you can see where the village is. This is a real African village.
Yes.
Haitian village.
Yes.
So I appreciate your. I've heard great works as soon as I walked in. And people were very pleased with your services.
Yeah. I mean, I had the two doctors here. They're talking some good things, and this is good. I mean, it's great the way you navigate the community and you bring everybody together. I think it's a wonderful thing, to give back to the community. People sitting out there, a lot of good information. That what she's talking about that have to do with the skincare. I usually just go to the place and just buy my cream and just cream, or and sometimes I just use Vaseline.
No!
Yeah, I just rub my face and I keep it moving. Yeah, and and they say, oh no, but I don't know, and so it's a good thing to know that you have at least. You can be able to get something from you, and that can make your skin better.
Yes, and it's all natural because, a lot of the products that we use, the lotions, if you go on the back of them and you try to read or pronounce what's on there, there's about 25 consonants in one vowel, and you don't know how to pronounce it, you don't know what it is, you don't know what it can cause to your skin. I've been using natural skincare since I was 19. I'll be 35 in October.
Oh, wow.
So I know for me, it was a different way of life, and it allowed me to show not only my husband, but when my son, when he was finally born, he's never used store-bought soap or lotion.
So it's a great thing, and we hope to. You say you have another health fair coming up.
Yeah, the men's health fair.
She's going to be there.
Yeah, we're going to.
Yeah, because it's going to be unfair to have.
We have a holistic.
So I'm going to get 2 shots, right? I can
we
get
have
shot
a
this
holistic
time.
person back here who's going to do a smoothie in a little while.
Oh, okay.
She's
Oh, okay.
going to be doing a lot of great talks about
So
how
if
she's
you're out
healed
there,
herself.
if you're out there,
How she's healed herself from
yeah.
a lot of diseases.
Yes.
With the natural stuff.
So if you're out there and I'm gonna get my massage, I'm gonna get smoothies. Yeah. I'm getting everything.
Get pampered.
Yeah, okay, I'm getting everything.
Snacks
So
in the front.
that's why it's good to be behind the camera, right?
Yes.
Okay.
All right.
Okay, so thank you very much. Thank you for
Thank
having you on here, and I hope you guys will continue this and continue to
Yes.
give back to the community. It's
Yes.
a good thing. You know, everything don't have to be cash.
Yeah.
You know, sometimes just giving back. And Marina, you've been doing a lot of cool job in the community. We hope to partner with you. If you can get in touch, I'll give you information.
Yes.
You know, we have audience, and maybe they can call you and buy some stuff from you.
Yes.
And maybe you can show me and tell me something so my wife can like me more. I can put myself together.
I
and all
got
that.
you. I got you.
Yeah.
Okay, good.
Yeah. So we want to say keep watching. We're going to take a break, and I'll be back later on to put somebody else on. Thank you so much.
Thank you.
Hey there. Many Liberians are members of social clubs, 501c NGOs, and school alumni. Many Liberians are trying to open their own 501c NGOs, home care agencies, and social clubs. Does your organization have a professional website? Does your web platform have the right wording and content to attract grants? Hopefully you're not running your organization only through social media. There's a more professional route. You need an online space where you can craft a positive message about your organization, making your home health agency more credible, which will increase your chances to receive grants. We'll build you a responsive platform for 501c organizations, healthcare agencies, and other types of organizations. We'll provide you with full website maintenance, membership sign-in, private charts, Facebook and WhatsApp integration, live video feed for all your meetings and special occasions, a dashboard for members to see all the activities, and email and text auto reminders for meetings. We'll build with donors and 501cs in mind, and will help you solicit grants and automatic membership due collections. Building you this amazing platform will only be a membership fee of $19 a month. Call or email us now. Let's upgrade your website. Home health agencies and small businesses, you owe it to your company to project the best image possible, and we can make it happen. Visit www.tiamit.com or call 215-966-8679. Ask for Tommy.
So we're back, and I'm here with one of the welcome at this place, at the New Lens Health. Yes, yeah. I came this morning and I was running around, and she said, "Oh, you just passed by me. You're not saying hi to me," and I apologize and everything, and now I'm free, right? I'm a free man. So tell me about this place. What is about this place?
Okay. New Lens Health is a primary care doctor's office.
Okay.
So we are open to see everybody who
Okay.
need a primary care service.
Okay.
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 This is the doctor's office.
Okay.
You know, whatever primary care need you have, we have it.
Okay. So how did the health fair got connected to this? You know?
Yes. Okay. The health fair got connected to this because we all did the same work at the community.
Okay.
Okay, Miranda is working out there for the African and Caribbean community.
Yeah.
And I was doing the same work before I came to this clinic.
Okay.
You know, I was out there working with African Diaspora Health, which has Dr. Kokwa as the director, and we were also working for the African and Caribbeans in the community.
Yeah.
That's how I got connected with Miranda.
Okay.
So the connection stayed, and we were just helping African and Caribbeans together.
Okay.
So when we opened the clinic, the connection was already there.
Okay.
Yes, the connection was already there, and we just continue what we were doing.
So how many days the clinic is open? How many days you guys open?
How many days?
Yeah. Is it from Monday to Friday?
Yes, and not Monday to Friday. The clinic is open on Mondays, Thursdays, and Saturdays, 9 to 5.
So those of you that will live in the community and you want to have a place, this is a very nice place. I think it's beautiful.
Yes.
The doctors are really nice here. I see they have some volunteer doctors that show up for this program and stuff like that.
Yeah.
Do you have a doctor that is here that is part of that too?
Dr. Kwakwa is the director of this place.
Okay.
And I'm the provider that is here every day. I'm the nurse practitioner.
Oh, nurse practitioner.
And I'm
Okay.
here all the time.
Okay. All right, so we located on 6449 Rising Sun Avenue, right?
Yes, 6449.
6449 Rising Sun
Rising Sun
Avenue.
Avenue.
Yeah, it's right in the northeast.
VIP A19111.
Yes, okay. So we will encourage everybody to try to make use of this. Those of you are out there from the Caribbean, if you're from Guyana, Liberia, wherever you are, this is your place to come. We got a nice, beautiful lady here that will be able to service you. She will talk to you. It's good when people come and know that they see somebody that looked at them.
Yes.
It's easy, to communicate and have them to service you the right way you want. So we want to say keep following us, keep watching us, and we want to say thank you for sitting and following us. The health fair was very nice. They had a lot of good stuff going on, and we'll continue to encourage you to continue following the Liberian Radio and Television Network. Until then, we want to say thank you for watching, and God bless you. Thank you very much.
Thank you.